Bottom line is the person receiving doesn't really care because you are touching them and it all feels good to them. Right? Much stretch on your arm here, lengthening that up. So she's getting work on the shoulder, the neck, her arms, all of this at once, which is very nice. Now I'll be very careful to come in with the knee. I'm going to come in right here at the base of her trap. And I try to, again, I have a very bony knee, so I have to be very careful about where and what part of my knee I'm using. And I know I use this a little bit more often on most of my clients, but I feel like you might want it to be more of the fatty part, not so much the bony part. Is that okay? And I'm barely, just barely going in. As soon as I feel her muscles resisting it and like kind of collapsing around my knee, that's when I stop pushing in. You don't want to go too far, too fast, because it's going to be very uncomfortable if you do that. And that defeats the whole purpose of what we're doing. You doing all right?
Yeah.
Okay.
Itch.
Okay. You're not allowed to itch? What is this? Now I'm just making my way up slowly. I'm feeling some resistance here, so I'm just going to go real slow. Not a whole lot of pressure here. And again, trying to be aware of your clavicle, your scap, all the other bones in this area. I think those are really the main bones. Are there any other bones? Slowly coming out, slowly going in, a little bit further up. Is that okay there?
Mm-hmm.
Okay. Very gently, very slowly making my way up to the very edge of her shoulder here. Nearly sent her jumping.
Yeah, I'm on my edge.
Okay.
But it's nice. I like
Okay.
it.
It's okay to send people to their edge. We just do not like crossing it because then it defeats the whole point of what we're trying to do, which I've had to learn because I like to send people beyond their edge. Oh, that hurts? Oh, okay. And then I come back down and just kind of reassess, slowly going in. This time on the second pass, I do go a little bit deeper than I do the first time. And then I'm very slowly moving my knee up. It's so slow you can't even really see it. Come out, back in. Oh, felt a little pop there. And if you tend to like sit on one spot for too long, that might get a little uncomfortable. So trying to be mindful of that as well and like kind of moving around on where you're hooking in and what you're using. I usually try to use just the pad of my hand and not like fingertips or anything like that because that can get really uncomfortable really fast. So I'm going to come out of that. Oh, I just kneeled on your hair. I'm going to come into her neck, move her necklace up. I'm not choking her. Going to be using this part of my arm right here. very slowly. So what I'm doing is I'm coming to this back part of her